Hi everybody. Thanks Pawan for so much glorified image of mine. So the direction for me for 15 minutes here is that I should be talking about, my direction is the goal. The goal is here is I'll be talking about what, why, how, which, all this about drugs. So the moment I say the word, use the drug, the connotation is really bad. Why drug is needed for mental illness? I will just adjust my lifestyle, I will do something for it. This particular question is the first question we always come across with all of our family members, and in fact the family members of the people affected by schizophrenia. So why we are so much bothered or worried that why don't we think it's just a small behavior? The problem with why. The first question is why pharmacotherapy. Alright, so I ask you a question: if malaria is there for you or typhoid fever is there for you, why don't you go for meditation? Why don't you go for just for a walk and just think about something and take deep breaths and wait for the malaria to go? It cannot. It is a physical illness. In the same way, I want to like to tell you is schizophrenia is not a psychological, just he is just out of mind. No, it is not just out of mind. He is having something which is damage in his functionality of his brain. If you take the image of the brain, to see the brain, his hand moves, everything is fine, the structure is fine, the way the function is doing, the perception, how it perceiving. Somebody is seeing at me, I think that no, something he is doing something against me, I think he may be having some gun or what, I don't know. So he may be moving his hand like this, no, he is about to kill me. So that perception is aware that it is wrong. So how to deal with this? That's why we need something as the drug. The first thing is why. So why a drug? This is why it is needed. It is a structural, it's a physical, it's a physical illness. When I'm talking about the structural is not seen on a microscope, it's not seen on a compound microscope, it might be seen on electron microscope, wherein the messengers from one cell, inside the cell, there is some repercussions which lead to some kind of a neurotransmitter variations which lead to this problem. So we deal with this variation with the pharmacotherapy. Why do you shampoo your hair? You can just put water and come off. You need something. That's why tablet is needed. Okay, so this is why pharmacotherapy is important. Now how this pharmacotherapy will help you, how a tablet is needed, why, how it helps. So brain is not just a single room like this. It's just like your house. It has got a kitchen, it has got a living room, like that. The same way it has got 4 lobes in our thing. It's not just single room. It has got something which thinks, something hears, it is something sees, something works. So I say pick up the pen. The waves hit your ear. It goes towards this. It analyzes. It sees the register, which is a male voice, female voice. What should I be doing? See the pen, where the pen is, then the pen will be seen. Then the message goes to the other part of the brain, that is another room, that is occipital lobe, wherein actually where the pen is has been assessed, and then it comes to one particular area, that is this frontal lobe. Should I be hearing to him? Shouldn't I not? Why the hell I should be bothered about him? So these kind of questions comes here. So this says yes, okay, when this says yes, then it goes to this particular part of the brain, and then this hand is just a mini earth mover or a JCB which moves and pick up the pen. If this doesn't say yes, no, I'm not going to pick up the pen. So this is how just picking up the pen, the brain whole actually works. So the impulses that somebody has told to pick up the pen is a stimulus. For that stimulus, the person has to react. So this interaction to happen, there is connection between these 4 rooms. There is a station, 4 stations are there, and the station has to be connected with wires. Now what? So how many wires we do have? If I keep one wire, another wire, another wire, another wire, it will encircle the whole earth 3 times. Not my brain, everybody's brain. Okay, not, it's a single brain. It's a single brain has got so much of wires, so we are all wired up. The problem is that how these wires are connected. Okay, now coming. So each wire is not touching like this, as this is the electricity here. It's something that a gap is there between one wire to the another wire. So this gap is called as a synapse. So an impulse has to go from this wire to this wire. How it goes? There is no thing, physical touch here. It just puts a letter here, and this letter goes to this wire. Got it? So this impulse is passed to another wire. Why is this being given to us? Why? Because for one problem there can be many solutions. So we have got many solutions as a human. For an animal, you have got some animal, it's now tea time, it will be just going and rushing and having a tea. But you people are humans and you are just waiting for my talk to over. So you have got one problem, that you are bored, or you want a tea. Now you have got many solutions. You will wait, you will see like this, or you will be not bothered, you will be sleeping. So you have got 5 solutions here. So this is how we are humans. So where I am coming, am I deviating from the topic? No, I am still in the topic. What is this? So one problem, there are 5 solutions. That is, one neuron is connected with so many neurons so that it can give many solutions to it. This is how our brain is. Why schizophrenia is not there in animals? Because one problem, one solution. We think a lot. It's a lot of intelligence is also a problem wherein we think. So this is where the problem is. Now there is somebody who is just moving his hand to his pocket. Then I see that my eyes has seen him. The eyes has seen him. So the impulse has come to this neuron. The letter, whatever it is, the neurotransmitter which has to go for this first neuron, it goes to the last neuron. If it goes to the first neuron, the perception is, okay, fine, he is doing something else. But it goes to the last neuron, no, he is bringing up the gun to me. If he goes and hits me, better I go hit him first and then see later. So this is how the abnormal behavior becomes, just because of the perception. He is perceiving wrongly. Structurally, his hand is fine, his eyes are fine, he is beautiful, he is working, he is handsome, everything is fine. All of a sudden he thinks that my colleagues are putting camera inside me, somebody has to just put the table nearby. No, somebody is putting camera. He perceives that. So where am I? Am I again debating? No. The problem is the neurotransmitter is moving to a different thing. If a postman is not there, he is now obsolete. But the problem is that if you have to put the wrong letter to the wrong people, those people will be horrified. The same way, the perception is wrong. What does these drugs do? How does this drug help? It just blocks the unwanted doors. So unwanted door was what? The last one on it just blocks the unwanted doors, and only the open door is, only the good doors are open up. So I give Respirodon, antipsychotic. It has got other things and all, but it closes the unwanted doors. So the door which has to be open, it is open. Even the person is holding here, puts hand here, doesn't matter. Hell with him. I'll be just oriented to my work, whatever I am doing here. That's why the drug is needed. How the drug works? This is how the drug works. We just not ask the patients to just pop in, go, come, go. That's not the way. This is how. So in anesthesia we see the reaction in within 1 minute, 2 minutes, 3 minutes. In medicine we see within hours and all. In psychiatry we need to wait for how many for the response to come. Why? It's not a single thing that we are blocking. It's a multiple thing. When a behavior comes off from a person, it includes his experience, his memory, his IQ, his past experience, everything. Tomorrow you come to this same kind of a gathering. Next time, if it was a good experience, you will come. If it is a bad experience, oh no, not again. So this experience also, your behavior coming here is also a problem here for you. So this is how our previous experience, our IQ, our other issues like genetic issues. If my brain, my structuring is so well nerved or wired that I end up in having the trouble of, even though the good neurons are there, but still I pursue it as bad only in spite of doing lot of things. Then comes the resistant cases. So this is how, my dear friends, this is how the drugs work, and this is why drugs are needed. So the word drug is not actually the drug, it is actually the food. It is a food for him, so that something is needed to at least block the unwanted doors. If unwanted doors are there, then again the problem will arise. You people are looking at me, everybody are hearing, at least they are nodding to me, and they just hearing to me. There are so many sounds out there. There is some person's the sound from that also. Why are you not deviated? You could have seen like this, no? Why? Because you are able to filter, you are able to focus. This is called as filtering. This is also goes wrong in schizophrenia. That's my drug is needed. That is why things are here. So you people, psychiatrists, you come, any patients, you do something and you put a nameplate on their head, you write a diagnosis, ask them to take a pill. So what to do? Everybody is having one or the other psychiatric illness. Out of 4, 1% is having a psychiatric illness in his lifetime. It is not my report. It is WHO report out of 2001's report, not now. It's 2015 right now. Just imagine how many people are having psychiatric illness. Some people do come to us, some people don't come to us. That's only the problem here is. Right? So I talked about why, how, why the drugs are needed, how it works. So anybody will be worried that drugs, what is the side effects? I'm actually asking you one particular thing. If somebody gives you telling that this pill is very good, this white pill is take it, then you take it. So many people go to other group of drug. I'm not telling that my allopathy cures every disease on earth. No. For hair fall, other things, yes, other things are there. But when we give a tablet in a blister form or anything, you get worried about the side effects. But you are not worried about the pills which are given in the white box without any name, nothing is there, but you take it, oh very good. Why? You should answer me. Because there are this don't know, you are worried about the side effects, there are so many front effects in it. You don't know why your liver is gone or whatever it is, you are worried about the side things. Why? How many people don't like, how many people like Pani Puri here? Everybody likes the way it is done, right? It doesn't have a side effects. Doesn't it have side effects? The moment you have Pani Puri, after 5-6 goes, you have burning sensation, doesn't it? It is not a side effect. Or else you might have loose motion in the morning, that's not a front effect. So, hell with these side effects. Yes, I am telling you, hell with these side effects. First, clear what the illness is, what you have got right now in your hand. Later on you worried about, yes, side effects we have to take care and we have to inform. It is our duty to inform you, and in fact you need to be aware of it. The moment the side effects is being told, people won't take it, but you need to be educated about that, and you need to be more cautious about that and see what best can be done for it. As a caregiver, you need to understand, okay, this might cause this, so we have to be prepared for this. When this occurs, what we should be doing, whom should we inform, these kind of things you need to be aware of rather than side effects. No, through it. So you have got always, you have to outweigh things, you have got lot of things. You know the weighing machines on the previous things, you have got 2 weighs here, you put a weight here and you put something here, right? In the same way you have to weigh. You don't take the pharmacotherapy or the drugs, the problem will be this much. Okay, fine. If you take the tablet, some problem, yes, it may be this much. What is this? If the patient in himself is a worthless vegetable just lying like a table, is it good? You are making some person to run out. He is making a productive person. I have got so many schizophrenia patients working for big companies. For example, IBM, he is earning 3.5-4.5 lakhs, and below him there are 300 people. You can imagine so much he is responsible for 300 people and their families. Say around 1,000 members, he is responsible for a society just because he is taking regular tablets and he is doing his job. You have seen Robert Nash. You have heard about him. Unfortunately, he expired. Yeah, John Nash. The Nash thing is okay. So the problem here is that so many people are happy with this pharmacotherapy. Why not you people? That's what my question is. That's the one thing. I answered it is why the drug is needed, how the drug works, and what are the drugs. So what other drugs are? So they are grouped in many things. We have got a lot of scientific jargon, antipsychotic, bad thing, this thing, this thing, this thing. That what matters is, will the patient, for you what matters is the patient becomes fine or not. So person is having a symptom which is added to his normal behavior is a positive symptom. A person which is having a symptom which is reducing from the actual normal behavior is negative symptom. Negative is something that he sits like this. Positive means is that he goes after, he'll be worried, hear some voices and all. So for negative things there are certain drugs, and positive things there are certain drugs. Okay, so every part of it right now, I'm telling you, is been so very well scientifically proven now. It has been all proven that the tablets are working, and you also see that that particular abnormal behavior stops after you're taking the tablet. So please don't go back, don't take a back step when the word drug or the pharmacotherapy is being mentioned. It is an illness just like typhoid or malaria fever. Please go ahead. Now you give a pharmacotherapy, then you restart your meditation, lifestyle management, everything. It will help you. If the person is dumb, how much ever you do this, what is the use? How much you tell him, it is him. How much ever you tell, no, somebody is coming to kill me. How much ever you give, that is what the symptom is. It's a false, firm, fixed belief. It's a false. You know that, but the patient doesn't know it. It's a firm. How much ever you give a proof, it is unshaken. How much ever you no, I have gone outside and seen nobody is hardening because of you only. No, they are hardening because of me only. No clue unnecessarily is hardening. So this is what is psychosis, and this is what is schizophrenia. This is why pharmacotherapy is needed. So I have answered you why, how, and what. What, again, there are so many groups that in detail I don't think this is the right thing that I can tell you about. Obviously we are always available, and some arrangements will be made in case if you have got doubts later also you can put forward to our team, right? So coming to the actual thing right now is that some people leave the tablets as soon as the patient becomes fine. The tablet will be left off. The patient is fine, I'll leave. The problem is what? Our treatment is just to make the patient lift him. The moment we come off, the treatment is gone, he will. Why? Again the unnecessary doors are. Who will close the door for it? He needs a tablet. Why? It is wrongly done. No, he was very fine. He stood on first rank in the 10th standard, 12th only he started to have all these things. This is because of that dirty teacher who told that because of this and all. No, that isn't. There already the perception in the brain is already gone. So we have to do something for it. Now if you give something, it will be fine. The acceptance from any people, the worst thing, nobody like to take it. They don't like to take it. Even if somebody tells that, okay, you have got schizophrenia, oh no, who the hell are you treating? You have got schizophrenia, you only go treat. You only take medicines is the first thing they will tell you. Even the patients will tell you that thing. Who told you? You are mad. Look, you are telling unnecessary things. You are mad. You go and have it. This is how the perception is. We have to be aware of it and move across, right? So the compliance part, nowadays we have got a lot of things. For example, we have got a depot injections which can be given monthly once. That is a terrific thing, and because the compliance only once prick and end of it. The levels of the tablets are very well maintained. It can be shelf life, it can be kept anywhere, anytime. We have got many depot injections. We have got tablets for weekly ones, weekly ones tablets are also now there. So we have got lot of array of medicines which has got both pros and cons, so which has to be discussed with you openly, and then we come across and then we come to a conclusion, right? So meanwhile I go through these slides. You please think about any kind of a doubt, you make a note of it so that we are available here and we can at least clear our your doubts. In case if you are not, we'll get back to you as soon as possible. Okay, to start with this first slide is that medication is the mainstay of treatment for schizophrenia. Yes, it is the mainstay. You can't just think about something else. You can't just ask the person to be fine just doing some homa or anything. I'm not telling, I'm not atheist. I believe in God. Doesn't mean that you do some mantras and the mango falls off. No, you have to throw a stone. You do mantra, okay, fine. At least the stone thrown, let it touch it. This is my fundice. right? You can't do anything. Yes, you believe in God doesn't mean that everything is this. Yes, we have to believe in God. There's no this thing at all. But still, we are supposed to do something for it. Yes, we have to take a treatment. That's the mainstay. So after taking that tablet, when the illness is reduced, obviously the side effects will be much more. So, after taking that tablet, I slept. Because the illness is not there. After taking the tablet, you are almost normal. After taking the tablet, you are going a lot of sedation. Those tablets has to be reduced. There is no rainfall. Why do you want an umbrella now? If the rain is coming, you have a big umbrella, small umbrella, depending upon the rainfall. So this is how the symptoms which has to be done. You are given high dosage. That's right. No, high, low in psychiatry is not that. Doesn't suit well here. Okay? It's just a group. It just works, it doesn't work. Why? Because our wires have got different doors, and these doors are called as receptors, and these these doors change from one brain to another brain. So every case is a customized services. We give a customized service to every case. We can't just put one shirt and ask, okay, you wear it. No. We have to tailor up that needs, particularly both the pharmacotherapy, the psychotherapy, and the social working things and other things, and whole team has to come up. It's just two hands make a clap. It's tablets giving. No. Where is other hand? No. It is. You also have to be involved. How? You need to be educated. Be aware of the next step to be taken. In the treatment aspect, it's always the target we see. The moment you come to a doctor, okay, fine. I want a person who is in this photo frame like this. Make it. It's not possible. Every time is a challenge. We meet first is the target. Target 1 is that let him take the tablet. Next, target 2. After taking the tablet, he is taking the tablet. Did the symptoms decrease? Next, target 3. The symptoms decrease. Which symptoms are still remaining? Which symptoms has to be reduced? He is working in software engineering. He is working in some this thing. His all team people are sitting. He is still having a lot of paranoid delusions that somebody is doing something against him. Then he will not be able to be in that team as a team in a working atmosphere. He will not be able. So that has to be reduced. So which is not reduced? Which is reduced? So that has to, again the target changes. So if this target doesn't be met, okay, plan A, plan B, plan C. So this is how we have to grow. Therefore, the team actually doesn't mean that doctor is the one thing. If you have got a small pimple or whatever, you have got some growth, okay, fine. You go to the surgeon, you give the thing, surgeon will chop it off, okay, fine, end of it. But here it is not. You are involved, I am involved, our team is involved, everything is involved. So it's a teamwork, it's not a single hand work. So this is where the problem with the schizophrenia and the challenges are. Right? So next thing is, what do these medicine do? Yes, I told you it reduces all the symptoms, improve concentration, improve functioning, decrease anxiety, depression, reduce. Yes, we have got tablet for anything. You have got very low, we are very high, we have got some tablet. Okay, but we don't have tablet for desire. So that we don't know. If it comes, I think addiction will be the best. De-addiction will be the best thing. So desire tablet is not still coming from the craving is there. Tablet for anti-craving is there. Okay. So common side effects, yes, salivation, weight gain, giddiness, drowsiness. Why these things comes? Because look, the particular tablet doesn't act on the same only receptors. Because receptors are present in the brain, it presents in my gut, it presents in my genital organs, it presents in my muscles. So even the muscle will get cranky, it gets stiff. A patient will be moving like a robot, he'll be turning like this. So what happens? Oh, something horrified. No, don't worry. Things comes. Please don't get annoyed. Just come. We will sort it out. It has to be sorted out. If that occurs, another tablet is there to be given. So, but our target is his acute symptoms has to reduce. His psychosis has to reduce. He goes hit somebody. He goes chops off somebody. He takes a chisel and he chops off. At least that reduces. Later on, let him be a robot or whatever, we can manage it. Okay, these are the mild side effects. Doesn't mean that the thing will be remain forever. The one problem with here is that as soon as you take the tablet, the thing will be living for lifelong. It's not like that. You take the tablet, it works and goes back in the urine or in the motion. It can't stay in your body. Yes, it stays. Some tablet stays for 24 hours. 48 hours depending upon this elimination thing. So once it's been given, okay, fine, it's been done. No, it's not like that. Okay, but the depot preparation, again, it has got the time. It has got 1 month, 45 days, like this, right? Yeah, so side effects are this, that. Next one. Yeah, what happens when patient doesn't take? You will be better knowing rather than me. The moment the patient stops, on that particular day, the patient might not have any problem. Next day, he might not have any problem. Third day, fourth day, he starts irritability. Even small things. You have kept this. I think you have kept something to annoy me only. He will start telling it. You have not opened the door. I know you wanted to do something. You not open the door. So you have put something into my food. It starts. Slowly it starts. It starts. There is no rational explanation at all for his beliefs. So that is when you come to know that yes, tablets are very important. Before you coming to know, please continue the tablets. Look, there is one thing. Here, if I got a fracture of my hand, for example, I got a fracture of my hand here. So I get all the plaster done. After the plaster done, I will be able to completely do it straight like this. So the treatment is complete. Okay. In case if the plaster is done and anything is done, and after the fracture I am not able to completely do straight, but at least I will be doing this much only, and I can't do this much. So what is this difference of this and this? That is called as disability. You got my point? Before normal I was extending it 180 degree. It's 180 degree. Okay. After the fracture I am able to do it 180 degree. There is no disability. And after the fracture, in case if I am not able to do 180 degree, I am able to do 160 degree, the disability is 20%. This creeps in, my dear friends. That is what we are worried about. If you giving the tablet, the person will be very well responding to in the first episode. Second, third episode, he starts. This is a disability which is a challenge for us and everybody. And the amount of disability will be more. This 20% will increase 40, 60, 50. Then it will be a problem. So be aware of it. Don't get afraid of pharmacotherapy. It is just a food. It is just food for the patients. Next. Reason for not taking medicines regularly? Yes, as I told you, many reasons are there. Patient doesn't want to take. Even if I get throat pain, I need to take 3 tablets for 5 days. I might take it for 3 or 4 days. Me being a doctor, I can understand taking a pill every day. This is where the challenge from the whole PU people and us people. What is it that we need to make sure that their mindset is that, look, this is it. It is needed. It is needed. To tell that, you have to make up your mind. First, you need to be aware. Okay. Next. Why is adherence to antipsychotic medication is important? Yes, I told you the maintenance phase. The disability creeps in. Therefore we have to adhere to the treatment. Doesn't mean that the person has got very much symptoms are less, the tablets are causing a lot of side effects. It might reduce or stop or change to another group of tablets. Okay. Yeah. What does the family need to do in the treatment? Yes, what you have to do is that first be aware of the illness your family member has. That is the first thing. Get educated regarding that too. Too much of Google for this part is I don't recommend, because a lot of other things are there in that with lot of masala mixtures and other things which is very difficult for us doctors to also tell you. But what I'm telling you is that you have got a problem, you omit on us, we'll catch it. But the problem is that don't Google unnecessary things. There are so many things that, look, you take this, that you think about the side effects, you please look into the side effects, the tablets, get educated. That's very good. So that you can come, you can make a list of questions, you can stand, you bombard us, we will answer it. Or we will give some books or references for you to just see to it. But you go to some websites and see other things. It's not just you are going to buy a pair of shoes or whatever it and see the ratings. You are not going for a hotel stay and see the ratings, 5 star, 4 star, 3 star. This is not. This is something else. Please don't get debated with those particular things. So you have got it, make a list of it, please. You just come, I'm telling the word moment, you just come and pour it on us, we'll have it. But the problem is that it gets really, the discussion gets somewhere else. Okay? Yeah. Never stop the medications without consulting the doctor. Yes, it is the one thing that he may be perfectly fine, everything is fine, no matter what, as our doctor said, 15%, yes, only single episode are there. The rest are, you might have relapses. You might not know that it is not in under the 15%. If it is on 20, 30, and it will be again a problem for you people. It will be a real big problem. So better to have a maintenance therapy, which may be 2.5 mg or 0.5 mg of whatever the tablet it is, but still you will be on a safer side. Okay. Continue to supervise medication even if the patient takes it willingly on his own. Yes. The thing is that he was taking daily, but last 15 days he has left. No, that is not it. You have to supervise. This is only the problem. You people get burnt out. Yes, I can understand. The burnt out thing, the feeling comes off when you see that you have to see it. That's why I'm telling you it's a food. Yesterday you have taken food. Why do you take food today? The same way, please think in that mentality. Yes, it is a food, and without food you are not living. The same way, food is needed, the tablets are needed. Okay. Remember, skipping, refusing medication can be the first sign of relapse of illness. Yes, it is one of the first sign of relapse of illness. Please take care of it. Right? Yeah. Alright, I think I answered your how, why, what, which of pharmacotherapy, but still, I think there are a lot of doubts. Within 15-20 minutes, I don't think that I might have cleared everybody's doubts. We are here. Please throw upon any kind of questions. We will be happy to help you. Our team of catapems will always be helpful for you people. Thanks you for your patient listening. Okay, thanks.